Welcome. I'm Nancy Anderson, Associate Executive Director of SMI. For our members, welcome, and for our guests, we're glad you're here to join us for this first program of the SMI 2021 Virtual Programming Calendar. We're delighted that you're able to join us today and looking forward to a really great program. Participants are in listen-only mode, and the webinar is being recorded, so we will have that available to members afterwards to use internally. And Mark, if you want to move it to the next slide. We will be using the chat and question panels or options today within the Zoom call. So if you'd like to share thoughts with the group as we're going along with the discussion, please feel free to just enter it into the chat. If you have a question during the program, you will again be on mute, but you can use the questions feature and submit it. Christine Dean and I will be monitoring the questions and sharing them with our panelists during the program. So let's make sure we get all the thoughts and ideas shared with this group today, with each other and with our expert panelists to make it as robust a program as we can for everybody. Next slide, please. So without further ado, I want to introduce you to our wonderful panelists today. We have Liz Wroe and Mark Hendrickson, who are both with Leavitt Partners. For some of you, you may remember that back in June of 2020, which now seems like 100 years ago, we had some representatives from Leavitt Partners talk about what they anticipated might happen in the United States from a regulatory and policy perspective as a result of different election outcomes. So we have invited them back again, given the fact that we've now completed the election and we've got a new president inaugurated and there's movement on new appointees. So we invited them back to trying to put a new spin or a new direction on what they spoke about in June and really put some more detail around it now that we've got a little bit more knowledge about what the administration looks like and where they may be headed. So we're really excited to have Liz and Mark with us today and excited that all of you can be with us as well. And we will look forward to the conversation as we go along this afternoon. Thanks so much, Liz and Mark. I will turn it over to you.
Great. Thank you, Nancy. And it's great to see so many familiar faces and nice to be back with you. I think if over the summer we had tried to predict exactly where we would be today, we probably would have failed epically. I'm not sure any of us thought that we would be here, dealing with a second impeachment, now one of a president that's no longer in office, plus the myriad other issues that the country is facing. So what we'd like to do today is give you kind of a brief overview of how we're looking at the 2021 landscape as it relates to healthcare stakeholders, particularly the political environment, a little bit about where we are with COVID, and then economic recovery. And I think we're going to try to go through that relatively quickly and then move into a conversation about just the policy outlook. What are the things that are on the Biden agenda? Where are we going to see congressional action? And most importantly, what are some of the key policies that we're tracking and where we could see movement relates to supply chain and some of the issues that all of you are dealing with. So we can go ahead to the next slide. And like I said, what we're going to do is talk a little bit about the political environment in general. And so I think over the summer, we had a slide that showed, here's the different outcomes of the election. We had a split Congress, we had a split administration, and where we ended up with this kind of Democratic control. And so I think what's important to understand is, yes, we have Democratic control, but we also have really slim majorities in the House and Senate. And so compared to, for example, what you would have seen at the beginning of the Obama administration, we really have very narrow majorities. And what that means is that there's not a lot of room for maneuvering. So we expect, President Biden, we've already seen this, to be really focused on COVID. Everything else is really taking a back seat. I think particularly because of those narrow margins in Congress, we're going to see a huge focus on what can be done through executive orders and administrative action. We could also see the utilization of this kind of fast track procedure. I'm sure people are starting to see more about this in the press, called budget reconciliation, which allows legislation to be passed in the Senate with only 51 votes. There's a lot of complexities that come with that process for sure. So it's not as easy as it sounds, but that is a potential vehicle if you can't find bipartisanship. And I think finally, we're expecting that it's a little bit of a hurry up and wait environment. So you'll see a lot of action around executive orders. At the same time, you're seeing slow movement on the Hill to, get nominees processed. Some of that has to do with the fact that the election results were delayed. So some of the normal transition activity just didn't happen in November and December like it normally would. I think you have to consider the impeachment potential process now in the Senate takes up Senate floor time. It takes bandwidth. That's certainly an issue. And so you have a number of different things that are kind of slowing down this transition. But again, it's still really active. So it's this weird thing of we're kind of in slow motion and then there's bursts of a lot of activity. And then finally, I think, we were talking a little bit about this before we came on the call, but, I think the events of January 6th in the Capitol, in addition to just impeachment, I think there's going to be some type of long-term effects, whether it's, how Congress moves around, how open certain meetings become in a post-COVID era, or frankly, if you see more bipartisanship because of that shared experience, or if it becomes more divisive. I think we just don't know right now what the lasting ramifications are. But I think we see these as kind of some of the key themes that are really making up the political environment. And we are going to make these slides available to you so you can look at the details, but we can just go through these three really quickly. This just shows you, how many cabinet positions have to be filled. Of these, I think there's only been a handful confirmed so far. Javier Becerra, who is the nominee for HHS secretary, his nomination hearings haven't even started yet. So just to show you, kind of where we are in the process. And you'll see on the next slide, we show some of the other appointees. And so if you think about it a little bit like a domino, you have your secretary, and then from that you have your sub-cabinet officials. And so to some extent, I think the incoming administration has done a good job trying to put people in their new positions, but it's all on kind of an acting basis. And you'll see from the next slide, we have, it's a very rare, I think very rare when a new administration comes out and rather than announcing their team, they're announcing who is in the acting, positions, because it's taking so long to get their folks in place. So I think that's really the administration story right now. They are staffing up, and that's going to, take a little bit of time. I will say, one theme we have seen is that there is a lot of power and stature happening at the White House. So particularly as it relates to COVID, you're seeing people like Tony Fauci, who has his job over at NIH, also being a White House senior advisor. So you're seeing a lot of people find policy houses at the White House. So it very much signals that we're going to be looking, for COVID in particular, the White House is probably going to be in the lead and HHS might be secondary. As we look at Congress, again, I think I already mentioned this, but in the House of Representatives, a really slim majority this year. So if you look, you need 218 votes to pass legislation in the House. Right now, the Democratic majority is 222 compared to last year, which was 235. I think a good historic note to think about is at the beginning of the Obama administration, there was a Democratic majority of about 257 votes in the House. So what that allows you to do is lose some Democrats. You don't have to hold your entire conference together. With a number like 222, that means that you're going to have to be able to hold people from more progressive districts. And then you're going to have to be able to hold people from more moderate districts to pass legislation, which just means there's a lot of front end work. And you'll see from the next slide, we're starting to see the House is a little bit further than the Senate in announcing, their leadership. Most of this is relatively, status quo and are folks that have been in these positions before. So I would say there's a little bit less transition when it comes to kind of who's doing what in the House. But again, you're now just starting to see members start to announce kind of who are on the key committees and subcommittees. On the Senate side, which you'll see on the next slide, is a little bit of a different situation. When you get to 50-50 in the Senate, essentially what happens is, because of the vice president being a Democrat, Democrats are now in control of the Senate. But that is a very, very, very slim majority. And so over the last week or two, Majority Leader Schumer and Republican Leader McConnell have been negotiating behind the scenes as to how they're going to share power. I think power sharing, we put it in quotes because they don't really share power. The Democrats, as the majority leader, Schumer will decide what comes to the floor. Democratic chairmen and chairwomen will decide what comes to a vote in Senate committees. So they still really have, they're still leading the agenda. The question is just how much can they lead an agenda on their own, or where are they going to need compromise? So just last night, it was announced that two Democratic senators have come out publicly saying that they, would never support any changes to the Senate filibuster, and that Leader McConnell basically feels like, okay, well, as long as we're not touching the filibuster, we can move forward with an agreement that, talks about what some of the processes are going to be like in a 50-50 Senate, so that they can go ahead and start announcing who are going to be the committee chairman, who are going to be the committee ranking member. And so you can see on the next slide, we have a kind of a list of who we're expecting to see in some of these key positions. And I think, unlike the House, this is going to be a dramatic shift, because you're going to see a number of Republican senators that were chairman or ranking members, they'll have left the Senate. And then you have a number of new Democratic chairs come in. So that gives you a sense of kind of who those people are. And then I think we had a quick slide in there on now that you have a 50-50 Senate, how do you move legislation? And really, you've got three choices. One, we call it regular order, which is essentially you need 60 votes to pass any legislation on the Senate floor. In an environment like that, folks that we call kind of the moderate middle, folks like Susan Collins and Senator Manchin and others, Senator Romney, Senator Murkowski, Senator Carper, I could go on. Those senators take on a new set of importance, because you're really going to need to have some type of bipartisanship to get anything done. If you can't have that bipartisanship, if you can't get 60 votes, you really only have two other options. And one option is this budget reconciliation process that I mentioned before. Again, that can be done with only 50 votes, but it's challenging. It's supposed to be just used to change numbers. And so when you try to do major policy changes through reconciliation, it's tough. And so, it's certainly a path that is open to Democrats, but it's one that's not easy. And then the last path really is eliminating the filibuster, which essentially makes everything in the Senate simple majority. So all you would need is 51 votes. And as I mentioned, I think this is a tool that, if you're Senate Democrats, you want to leave this out there as kind of a way to force bipartisanship, to basically say, listen, we're going to try to work together, but if Republicans don't come to the table, we're going to get rid of your ability to filibuster legislation, and now we're going to be able to move whatever we want. So I think that's kind of the threat that's out there. But the reality is you have at least two Democratic senators that have come out and publicly said, we're not going to touch the filibuster. So at this point, I think our current view is that that's an unlikely scenario. So we're really looking at bipartisanship or budget reconciliation. So I think those are kind of the main themes that we're thinking about when it comes to, what's happening in the administration, and then both the House and Senate. And so, Mark, I will pass it over to you to maybe give a little bit more of an overview. I feel like we've touched on this one of, now that we've talked about Washington, what's actually happening in the real world.
Sure, thanks, Liz. Yeah, some of the slides are a little delayed, my apologies, but I think we caught up. So the impact of all of that uncertainty, transition, change, it really does have a severe impact on the real world, especially with the current pandemic that we're in. The latest numbers have, as you see here, are just baffling. As of January 24th, however, we have somewhere in the neighborhood of 14 million people who have received at least one dose of the vaccine. So some progress is being made, some positivity and some good news is on the horizon. 35 million doses distributed, 16 million doses waiting to be put in arms. And this also highlights some distribution concerns and hiccups that we've seen. While the vaccine makers have manufactured the dose and the government in most cases has purchased that, getting those needles in arms can be a logistical challenge, to say the least. The Biden administration has made it one of their initial focuses to kind of get a handle on not only getting those needles in arms, but get a handle on the data so that they can track who has what, where, and make sure that it's an efficient use of resources. There are, many folks have said, remaining vaccines that are being distributed, and it's the delay to get them to where they need to be has taken a lot more time. And you also have additional companies that are out there testing for new vaccines and new treatments of one kind or another. There are new studies, it seems like, every day. And then you hear the announcement of, one candidate has recently dropped out because their trial has not been as successful as they had originally anticipated. So there will be several vaccine candidates. There are now, and there will be more coming to market in the coming months, we anticipate. And so hopefully these numbers will improve astronomically. And then the impact that you have to the current pandemic and the policies that we've been talking about do have a huge impact on the economy. Partial or complete shutdowns in some areas last year can't be understated. Consumer confidence was very low for a time. Job losses were cascading, but we have seen some increases in some of these areas. Consumer confidence is growing. Some of the jobs are coming back. It seems like we still have a ways to go. And I don't need to dive into every bit of all the data here because there's a lot going on this slide. But one thing I did want to highlight, though, is shortage of PPE and other kind of critical equipment that we've seen. It has really slowed down the recovery for some firms. Some small businesses in particular have been extremely impacted. But on the flip side is you have Walmart and Amazon and some of these large, internet-based retailers who have thrived and have higher revenues than they've seen in years. So it's an interesting dichotomy to see that there's certainly not a consistent growth there, an assistant coming back to work. And we've also seen it's also very regional. Just different parts of the country are impacted more heavily based on the industries that they have. Travel industries in states like Florida, for example, have been extremely hard hit. Service sectors throughout the country, restaurant workers and so forth, are still getting back on their feet. While some companies have done well, some of these folks are still have a long way to go. Income losses, small business closures, we're starting to dig out of some of that, and we know the Biden administration is really leaning forward on some of those policies, but it does look like we still have a ways to go. Now I'm going to pass it over to Liz to give a little bit of a policy outlook.
Great, thank you. And we can, go ahead and get started. And I want to echo Nancy's comment. Please feel free to suggest questions in the Q&A box. We really, want this to be a discussion and want to make sure that, we're giving you guys insights in your companies and the work that you do. So if there's topics you want to make sure we cover, please feel free to let us know. This is just a basic time frame. When you have a new administration and a new Congress, people tend to try to think of things in chunks of time, and the first really being kind of the first 100 days and what can we expect. And I think as we've talked about, you see a lot of stuff happening at the administration level. So far, I think the administration has had, for the last week, they're doing theme days where they're putting out executive orders and other activities. Yesterday was Buy America, today is equity. Thursday will be healthcare, so we're expecting more healthcare executive orders and actions on Thursday. And then you have, as we've talked about, Congress trying to get itself organized. And then you relatively quickly bump up into the budget process. One note, I would say, this kind of pings into what we talked about a little bit about budget reconciliation, and without going too far down, I used to work at the budget committee, so I'm going to try to not go down the budget committee rabbit hole. But it's interesting. You usually think of that you would do one budget every year. That seems like a really kind of normal concept. But interestingly, because Congress didn't actually do a budget last year, Congress may be able to do two budgets this year if they can get one done really quickly. So the first budget would be for the 2021 fiscal year, which we're already in. If they could pass that in the next 2 months, they could use that as what we call kind of a vehicle to do this fast track reconciliation. They could then come back in April, May timeframe and do a second budget for the 2022 fiscal year and do a second reconciliation bill off of that. So what we're anticipating now is January, February, March, I think maybe April, but there's a real focus on March because unemployment benefits expire in mid-March. So you're going to see a real focus on COVID relief, for that first chunk of time. And then after that, our expectation is that the focus is going to be a little bit more on some longer term structural reforms around the economy. So think about, tax changes as well as healthcare. So longer, term structural changes to the Affordable Care Act, Medicaid, Medicare. So that's kind of the current thinking of when timing might happen. But again, there seems to be this sense of you really need to get something done on COVID before you hit April. And so that leads us to think, a lot of those other big ticket items may have to wait. And so we can skip the next slide, Mark, because I kind of just verbally went through it.
Liz, can I just interrupt? We've got an interesting question. I think you just addressed it a little bit, but we've got a question about early insights or any kind of discussion about the new administration's plan to make major healthcare reform that might impact our members, both on the supplier and provider side.
Sure. I mean, I think initially you've seen, and actually, let's get to it. If you go to, sorry, Mark, I'm all of a sudden I'm a backseat driver. But we have a slide that shows what the president is proposing in his COVID package. And as part of the COVID package, there's one change particularly around Affordable Care Act subsidies. So I think you could see in the context of COVID, some small changes on healthcare reform. But I think that second group of changes, I think you're going to see a couple things. One, look at what can be done through administrative action. So whether it's changes on drug pricing, the last administration did their most favorite executive action. I think it'll be interesting to see if this administration thinks that they can do something on drug pricing or price transparency using executive action. I think there's a number of things. This is maybe not as direct, but I think there's a number of things kind of in the Affordable Care Act space that can be done through executive order. I think we're going to see a new special enrollment period, probably announced on Thursday, where you're going to have a lot more people have the opportunity to enroll in ACA plans. And then, things like limiting short-term plans or association health plans. So I think there's going to be a little bit of a contracting where you see a lot more focus on getting people into ACA plans, utilizing the ACA exchanges, and really kind of limiting kind of other health insurance options. When we get to the structural, kind of more structural reforms, I think, everything we've heard is that there still is a lot of work that has to be done to come to consensus within kind of the Democratic Party about what some of those changes are. But we should absolutely anticipate, a coverage expansion, which it's probably more likely that it's a combination of expansion of ACA subsidies, expansion of Medicaid, and then some change to Medicare eligibility, whether it's a buy-in or reducing the age. So rather than a new public option, what's probably more likely is that you're going to see tweaks to those existing programs to kind of all fit together as a comprehensive package. I also think we'll see drug pricing as that as well. When we get to the end of the slides, we've got some slides on kind of the Defense Production Act and some things on global supply chain, which Mark's going to talk about. So I'm not going to steal his thunder, and I'll let him talk about that when he gets there.
Liz,
Yeah.
we have another question that I think is more relevant to what we're talking about right now. That it's Karen Conway indicating that she's spoken to believe the Biden COVID plan does not include enough focus on how to ensure better coordination between the federal government, states, and the commercial supply chain. And so the question is, are you all seeing things about that the rest of us might not be seeing right now?
No, I think that's right. I mean, I think you're hearing from states saying, we got sent these vaccines and we're not quite sure what to do with them. I also think a real issue is you have a traditional supply chain, you have a traditional healthcare delivery system that would normally handle vaccinations. And I think there has not been enough work figuring out what are the ancillary supports and industries that you can bring to bear to actually do a vaccination campaign, the levels of which we really need. And so I think, I do feel like late into last year, while there was this excitement about a vaccine, I think there was a lot of concern, and even in the fall, that there may not be the plans in place really around administration. And so I do think that the Biden team is looking at what they've inherited. They've obviously put out this vaccine distribution plan, which we have here on the screen. They're making changes to it daily. And I think that we're going to see even more of a focus on the federal role in coordinating between the states and the private sector.
And I think that's the key kind of pivot point is the previous administration really wanted it to be at the state and local level, and part of that's just the philosophy of the administration and how they approached a lot of policy issues. And this, for one reason, they really felt strongly that it needed to be administered in that way. I think the Biden administration has a complete opposite approach. And based on what we have been hearing, there is really an interest in increased coordination, collecting that data so that they can follow any adverse events. They can make sure that they're efficiently distributing, making sure they're covering the populations that are really most at risk. And that's pretty consistent with what I've seen and what I've heard. The Biden team is really going to turn it on its head. And, you've seen a lot of hiccups in the news and, there's still ways to go, but they seem to be, consistently trying to get their arms around what they inherited.
I think one other point I would just say, last March or so, when kind of things, or I guess it was February into March last year, when I think the reality of COVID really started to hit this country, and things shut down. We had a number of months where I would say every day felt so unsure, because we weren't really sure what the full extent was going to be, how many communities were really going to be impacted. For a while, I think people thought, well, it's really just New York and like everybody else is going to be fine. I think there was this kind of, this huge sense of uncertainty. And then over time, we just got used to the uncertainty, frankly, and started to build it into our standard operating procedure. I think that's something we need to continue to remember, is that this is still novel. So yes, we have a year. We have a year of doing this, but this is still a novel virus. We have not, because of that, we have not actually as a country had to do a healthcare activity of this extent in the modern world. And it really, our healthcare system is so complex. and that it really calls on every single piece of the process to almost work perfectly, which is just inherently really challenging and just not realistic when you're dealing with human beings. So I think it's understandable that this is a challenge. And I think even as the new administration comes in and there is more federal oversight and more federal direction of a plan, and that we need to continue to expect that things will change as facts on the ground change. And again, I keep going back to this thing of it's still novel. Like, we still don't know. You'd think a year into it, we would feel so much smarter, but there's still so much to learn. And so I think, this administration team, I think from what we've seen, I think will be maybe more open to pivoting as facts on the ground change and they need to make adjustments. I think that's one thing we'll see. Whereas I think before, there was a concern that if the facts on the ground changed and you pivoted, it was somehow an admission that, you didn't know what you were doing, or you weren't doing things the right way. Whereas I think this team seems to understand that there's going to be a need for adjustments as we go forward.
Yeah, and one last thing I'll add is looping back to the previous question, just about, kind of big events that we're anticipating, big policies. First 100 days, I think you're more likely to see the executive actions because the president can put forth policies that have a real impact really quickly. And Liz laid that out really well. I think then kind of your second batch is what's Congress going to do? What are they going to do longer term within the year? What kind of areas are they going to tackle? I think we have heard a lot of interest in kind of evaluating the process, the regulatory process for COVID, how products were reviewed at FDA, how trials are being held, and a lot of different kind of really technical issues I think are going to be evaluated. I also anticipate there's going to be a lot of blame game going on from, what went wrong last year, what are we doing better, who's at fault. Unfortunately, I think we're going to see some of that, and it's just kind of inevitable. And then longer term, you have a lot of the negotiated user fee agreements coming from industry, medical devices, generics, biosimilars, innovator products are all due. And most of those negotiations are either ongoing or near completion and will go to the Hill. Once those are on the Hill and are being discussed, that's when we tend to see, kind of big balloons of healthcare issues coming to bear. In some cases, some committees and some offices will almost hold on to those big policy issues that they've been wanting to deal with until this big vehicle comes about, and it kind of opens up the broad interest in some of these discussions and debates. So I would anticipate later in the year, we will actually have a very robust conversation outside of just COVID, although COVID will be a part of that discussion as well.
Definitely. No, I agree. And actually, if you don't mind moving to the next slide, we're going to kind of jump right into that a little bit. With what the president's number one priority is this COVID package, this rescue plan, and it is bipartisan conversations have just started. I think it is the president's stated goal to do this in a bipartisan manner, as we talked about. I think the question's going to be where do you have bipartisan support for additional spending right now when it comes to vaccines, testing, and some of kind of the core, I'm going to call it public health issues. There seems to be more alignment, more bipartisan support for additional funding and policy in that space. Where it gets a little bit, dicier is a minimum wage increase, some level of, direct payments to individuals, although I think you probably could get some decent Republican support right now for direct payments of $2,000 for individuals. If you go much higher, I think it gets challenging. So that's really what they're trying to figure out right now, is what can they get bipartisan support for? Is it going to be enough so that the administration feels like it will actually have a real impact both on the healthcare crisis as well as stimulating the economy? And if not, if they can't get bipartisan support, what can they do, on a party line basis? That's kind of where that reconciliation process comes in. And then it's kind of a question of, well, what are you allowed to do in that process? You can spend money, you can change taxes, but to do a lot of policy changes can sometimes be challenging. So that's really where, I think things stand right now, is just beginning to have these conversations. And I think it's fair to say that there does appear to be, bipartisan support to start dealing with some of these issues. I did see a question regarding kind of corporate tax changes. One of the things that is going to have to be dealt with is whether or not any of this spending is offset. So if it's done the way the previous COVID bills were done as emergency spending, need to pay for it. You would need to have an offset. If they go the budget reconciliation route, they may need some offsets. There's some budget rules that we're not going to get into, but they may need to offset some of that spending. And so then you think about, okay, well, where can you take that from? And I certainly think corporate tax changes are probably on that list. I would generally think that big structural changes to corporate tax policy would be in that second vehicle that we've talked about, because I think that's a core part of the larger economic and frankly healthcare policy changes that Democrats want to make. And so to me, frankly, that's such a huge offset that it's more likely that they would try to find a way to not have to pay for this spending and then do corporate tax issues as part of a larger tax and healthcare overhaul. That's just kind of what our thinking is right now. And then let's fly through the next couple of these so we can get to, as Mark was saying, a little bit more discussion on some of these specific issues of interest. We've mentioned this a bunch of times. We don't need to get into any more detail. A lot of executive orders already happening, a number of healthcare ones so far. And again, yesterday was Buy America Day, and then Thursday will be additional healthcare executive orders. So I guess expect to see more on that front. And then next, we touched on this a little bit, but we've tried to think through like, okay, in the dynamics of where Congress is today, where are there areas where we can see bipartisanship, where, potentially, and then kind of where are some things where there aren't as much. And I think where it comes to the core COVID response around like the public health response, I think there continues to be openness on a bipartisan perspective to, spend in this space as well as, change policies as necessary. I would put, provider support in there as well. I think, trying to get a sense of right now, what is the stress on the healthcare system? What are the stress on hospitals? What's the stress on providers? Taking a look at that. I think that is definitely in the bucket of things where, we feel like there's some bipartisan support. When you move further from COVID, maybe some bipartisan support for things like looking at the role of public health and public health data and surveillance. A lot of those systems are really are old and antiquated and need some investment. Things like Cures 2.0, what are the authorities for fast tracking, medications? As Mark talked about, like the user fee, the FDA user fees are coming sooner than people realize. Or what about, policies addressing social determinants of health, things like access to food and transportation that are really needed in order for people to actually have good health outcomes. And then you get further away where you start to have kind of further, less alignment. And that's tends to be on these large structural issues around, the Affordable Care Act. The Affordable Care Act, definitely one of those, drug pricing, Medicare, Medicaid. We also just had a great question about where we would put kind of liability protections in the COVID space, as well as state and local aid. I would say both of those, at the end of last year, the reason that Congress was able to pass another COVID bill was because they essentially put those two issues aside. I think it's easier for me to see compromise on the state and local financing issue. I think the challenge on the liability protections, purely from an operational perspective, is my understanding is that there has yet to be identified a good middle ground. So it's either like you have the liability protections as drafted by like Leader McConnell's team, but there hasn't been enough consensus, I think, on if there is to be a bipartisan compromise on liability protections, what does that look like? And I think that's part of the reason it didn't happen.
Yeah, I think to answer the next question up here, Liz, I think your audio cut out for a second. Surprised that telemedicine is in less alignment category. I think there have been opportunities for bipartisan support here, and there's been a lot of conversation around the benefits in a COVID environment there. But what we have seen is some lack of alignment on how it's paid for, and how is the data being treated. So some of the privacy aspects and then payment aspects have been areas of concerns. I'll ask Liz if she's able to rejoin to answer the next question about liabilities.
Yeah, can you hear me now? I feel like great. And I'll go off video if that happens again. I did see that. I think they've looked at a number of different liability options. So I think comp is one of them that they've looked at. I think they've looked at things similar to like expanding the PrEP Act, which is liability protections, for vaccines and medical countermeasures. Do you basically just say that everything in COVID response is actually a countermeasure, which is really not an artful way to do it? But yeah, I think the bottom line is I think they have looked at that. The sense I've just gotten is there has yet to be enough alignment from the legal community and different industries that actually want the protections around what that middle ground could look like. And Mark, I think I will hand it over to you to talk about, some of the more detailed issues that we know people want to hear about.
Sure, thank you. And feel free to jump in if there's anything else. But one area we knew that this group would be really interested in discussing would be the Defense Production Act. We do expect the Biden administration to utilize the DPA to combat COVID. We saw limited use of this in the previous administration, but we would expect even more use of it now. And a lot of that will come out of some of the thinking that was released in the executive order on January 21st. It was called the Sustainable Public Health Supply Chain, calling on a pandemic supply chain resilience strategy. And part of this is to kind of get a better handle on what the strategic national stockpile really has. How is it being used? What's in there? There's also some pricing aspects of this as well, around how are pandemic supplies priced, and then are there some recommendations to the president for some areas of relief or some areas to be concentrated on. Also, within 180 days of the order, the Secretary of Defense, Secretary of HHS, Homeland Security, and coordinating with some other national security offices within the administration are to select a response coordinator for COVID and provide the president with a strategy to design, build, and sustain long-term capability in the U.S. And this is a theme over the next couple slides, talking a little bit more about the Buy America, reshoring, depending on who you are and what you want to call it. It's all a similar, it's all a similar way of looking at it. It's essentially, how do we bring some of the manufacturing back to the United States? There have been some broad discussions about using the DPA to kind of aggressively encourage, I'll use that term, companies to make things here domestically, whether they want to or not, and have the government essentially give them that authority to kind of cut through some of the red tape and get these products quickly. We saw this in the PPE shortages months ago, where healthcare workers were not having the equipment that they required. And a number of senators, just as soon as last week, have asked for the DPA use to boost that production and stockpiling. We also saw significant shortages in some of the chemicals needed for some of the testing early on, and that continues. And then you think about the sheer volume of the number of glass vials, pipettes, and so forth. Some of these small pieces of equipment that we might take advantage of, and don't think about how critical they are to get the shots in arms, to make sure that the products are stored, make sure we can get the testing that we need. So I think we'll continue to hear about ways that industry can be encouraged or even compelled to step in the ring where needed. And I think that this administration will not be shy about using that as they need to. There's some broad kind of legal background for use of the DPA, and I think this administration will use it.
One thing I would just add, Mark, I think that's spot on. I think one of the things we've seen with with FDA's approach to drug shortages, for example, and then also the last administration's approach to the PrEP Act, which is liability protections for medical countermeasures, they started taking this view that it wasn't just about the specific things that we need to counteract COVID, the disease. So it's not just about the COVID vaccine, the COVID, vaccine vials. It's about, because of COVID, do we now have other supply chain issues? Do we now have other shortages? Are there other medications that, because I don't know this to be true, I'm just using it as an example, because Pfizer is now using so much of its manufacturing capacity for a vaccine, are there other Pfizer products, that maybe are creating a shortage? Is that happening in other areas? And so I think what's interesting about this last piece here about their broad authority is, do we start seeing our definitions of, what do we really need to combat COVID? When it comes to DPA, do we start seeing it become COVID related, products, or other things that because of COVID, we may have other, areas where we have supply chain issues. And so to me, I think that's just something to watch, is how broad is broad.
We do have a question that just came in again from relative to the Buy American executive orders from yesterday. Is there consideration about the government being able to do long-term contracts to make the business case for making domestic manufacturing competitive? And is there any possibility of the federal government collaborating on long-term contracts?
Yeah, I think that's an excellent point. I think right now there's a lot of kind of tunnel vision focus on the short term, and unfortunately not enough forward planning to look at the long term, in my view. And I do think there have been some discussions in the pharmaceutical space, for example, about some kind of long-term contracts with the government to make some of the antibiotics being one example, that some of these products really just aren't that expensive to make, and they're just not big revenue producers. And so more and more companies have gotten out of specific kind of niche areas that really have a critical public health impact. And so, as Liz noted, some of the shortages we've seen kind of across the gamut, even outside of COVID, there would be some real benefit to having certainty for producers of those products if there were the ability to have a long-term price, a long-term contract, so that they really have that certainty and predictability moving forward. Whether it's in a specific product or not, a lot of pharmaceutical manufacturers really have a broad portfolio of products that they have at any given time. And even if they're losing money on one, if they're making money on another, they're able to continue to produce a wide range of products. So I would think that would be a part of the conversations, but it hasn't had enough traction in the recent days to really be able to move forward. So continuing along the conversation around kind of reshoring, Buy America, it's a global supply chain, it's a global market, and we saw the previous administration using the term Buy America and almost looking at it from a nationalistic kind of point of view, shaming and blaming folks for not manufacturing products here. What I think Biden's going to shift some of that narrative to more of a, here's how we can jumpstart our economy, and really focus it on that perspective. But I think some of the underlying needs and desires are going to be the same. It's going to be having some certainty with the products that we need for public health, and how do we bring those back in line? How do we bring those back to a place where we know we can rely on the quality and access for some of these necessary pieces of equipment? And there was a recent executive order on the 21st, also re-engaging us at the global level with the WHO and some of the other global regulators. Something the previous administration didn't find useful, but Biden very quickly reversed that and is now refocusing kind of on the global stage. And then on the 25th, there was an executive order ensuring agencies using US suppliers, similar to previous Buy America provisions that we've seen. And then something that we expect is kind of an enhanced FDA regulation of the supply chain. The philosophical differences between the Biden and the previous administration. Previously, we saw kind of a need for speed in reviews and kind of regulatory activities across the gamut. I think we're more likely to see kind of a philosophical change here and focus on safety. How are we going to ensure that these products are safely manufactured? How do we, kind of evaluate that? It's unclear at this point who the commissioner of FDA is going to be. I think a lot of people have a lot of rumors, but some of the kind of drive for the organization is going to be the same regardless of who that person is, based on some of the career staff and the science. But really, frankly, the regulatory pendulum kind of swings back and forth based on the commissioners, HHS secretary, president, et cetera, or even the political party. And so our expectation is a little bit more focus on that safety aspect. And a piece of this is the inspections for FDA, which has long been an area of debate. And we don't need to get down that rabbit hole. I could talk about that for a whole hour. But there are a lot of kind of barriers here to really consistent foreign inspections of facilities, just because of the distance and the need for some of that that understanding of the kind of foreign suppliers and where just knowing where all of these facilities are. And the FDA doesn't always have all that information, which is baffling, but it's true. And then there's a lot of discussion around reliance on foreign manufacturers of medical supplies. A lot in both parties have been discussing this for a while. How do we make sure we can get those consistent products? Are there some price considerations there? I do anticipate that's going to be part of the pricing discussion that we've been hearing. And then finally, how long will the US supply chain be impacted by the global outbreak? I think we've seen that there's a likelihood that the current designation for a public health emergency is going to be extended, perhaps even through the end of this year. So I think there's a lot of implications there. And then finally, and I know we're getting near to the end of time, so I'll make it brief. Healthcare providers have attested to a significant amount of money. And so there is a real question here, and has been for a while, what is the true impact on hospitals and healthcare systems around the country because of COVID? The short term, what are the capacity limits? What's the economic impact of getting rid of elective surgeries for a time and now coming back to that? Are they going to be able to be more nimble? And I think part of that will drive additional aid from Congress as well. So that's all I had for today. Liz, if you could wrap up our takeaways, please.
Sure, absolutely. And yeah, feel free to jump in. And again, still would love to, with our remaining moments, if there's any additional questions, happy to talk about them. I mean, again, I think it's clear we are still in a COVID environment, and really looking at, how soon we actually turn vaccines into vaccinations really is a driver of how soon we also have economic recovery. And until those two things happen, it's very hard to see the administration and Congress really moving on to other big issues. And again, I think we've seen, it's kind of like in DC, I don't know, we're still getting our bearings. It's like everything changed and nothing changed. So it's a new administration, a new Congress, but we're still a relatively equally divided government and a divided country. And so it still means that compromise and hard work and figuring out solutions to problems is going to happen. So there's no easy, solution to many of these. And then I think, lastly, as Mark referenced, particularly as it relates to the supply chain, we are kind of going from this Buy America moment to re-emerging as part of the global public health community, at the same time having a better understanding of the needs that we have domestically. And so I think there's it's not a complete foregoing of domestic manufacturing capacity, but maybe domestic protection in a kind of a much more of a global universe. So we will end there. Nancy, I will kick it back to you.
Thank you, Liz. We do have one other question that if you have just a quick minute to answer. The question is, do you think the pricing discussions focused on pharma historically will expand into medical devices, including PPE?
Mark, do you have thoughts on that?
I do think that it will get broader. The discussion, I think there's been a lot more focus. I don't know about you, but I don't think I've ever spent this much time in my entire life talking about masks and gowns and things like that. And so I think inevitably there's going to be a real clear analysis of what that supply chain looks like, what kind of value is there, how do you differentiate a product from here or from there, what makes it better, what makes it worth this price. I do think medical devices and PPE are going to get a larger view. I know for one, based on some of the projects we work on, testing, broad testing, not just COVID, but labs and some of the testing out there, there's a lot more discussion, a lot more interest in really evaluating how that industry works, how they're regulated, and how to make that more efficient, make sure that the access, but the quality is still there as well. So I do think there's going to be a much broader pricing conversation post-COVID.
Thank you. Thank you. And Mark, if you'll just pop up my last slide, that would be great. But we want to thank Mark and Liz for joining us today. And before you leave our call, because I know a lot of folks are running to their next event, but we would love for your feedback on our evaluation form. There is a link to the evaluation form in the chat. So please complete that very, very brief evaluation, just so that we can make sure that we at SMI are always providing you with the most useful information that we can. We do have 2 upcoming programs. We've got a huddle call discussion group that's for SMI members only. That'll be next February 2nd, and you have all SMI members have received several reminders about that in their inbox. We're going to be discussing, among other things, vaccine distribution and how that might impact sales rep access to hospitals. Then on January 31st, in our continuing podcast series with interviews of our member CEOs, we will have conversations with podcast dropping, and that is Jim Zalagi interviewing Ed Pasica, the CEO of Owens & Minor. And then watch for an announcement that in February, scheduled for February 18th, St. Ange is going to provide a program for us focused on more of our emerging leader audience, but open to anyone. And it's really talking about learning from supply chains in other industries, and what is it that other industries do differently than healthcare, and how can we learn from that and adopt some of those different approaches to supply chain. That's just the beginning of our virtual programming this year. And from SMI, we've expanded our virtual offering, as you all know. And again, I'd like to thank Liz and Mark for being with us today and sharing some wonderful insight that we can all take and use as we plan our year. And we look forward to having the Leavitt Partners group participate with us again sometime in the future. And to all of our SMI members and guests, thank you very much for joining us today. We look forward to seeing you on future programs.